Good afternoon and good evening to everybody. You're very, very welcome to the University of Warwick Masters in Public Health and Health Promotion. We're delighted to have so many with us today from all over the world, particularly from Africa and Southeast Asia. So it's wonderful to have such a brilliant participation rate today. Thank you so much for attending, and we appreciate that you're so busy and very busy health workers and clinicians, and thank you for taking time out of your busy schedule. So just to let you know, the running order for today is, first of all, there's going to be a fireside chat with our Head of Academic Affairs, Mr. Diarmuid Brannock, and Dr. Sadaf Lyons. And Dr. Sadaf Lyons is a Senior Consultant in the International Association of National Public Health Institutes. She is a Public Health System Strengthening and Transformation expert. She has expertise and experience working in the UK, in the Middle East and Southeast Asia and Malaysia. And she's a member of the UK Faculty of Public Health and the Royal Society of Public Health. So we're delighted to have Sadaf with us today, and she's one of our senior academics on the programme, and she'll be talking to Diarmuid all about the motivations for doing a Masters in Public Health, and it's so timely and I suppose so necessary in this pandemic world that we're living in. Public health professionals are absolutely essential. So the motivations for doing the programme, and you know, all of the, I suppose, what to expect in the curriculum, and the career trajectories post qualification, all of that will be dealt with in detail at the fireside chat. And after that, we will be going to do the programmatic overview with Mr. Diarmuid Brannock, who will give you the curriculum, the tuition fees, the time commitment, the entry requirements, all you need to know. And finally, we'll finish with a Q&A session. And so any of the questions you ask in the chat, we will read out in the Q&A session. Having said that, please go nuts in the chat. The more chatty you are with us, the better the experience is for everybody. So if you have any questions, please ask them, and we'd be delighted to answer them throughout the webinar, and then we'll finish with the Q&A at the end. So now I'll stop talking and hand you over to Diarmuid.
Brilliant. Thanks so much, Rebecca. And just to echo that sentiment, lovely to see you all here, and delighted to be joined by Sadaf. I think, yeah, the purpose of this evening is to give you as much information as we can. And we'll start with just really a conversation around public health and our approach to creating this program. And then we'll get into a lot of the detail. Sadaf, do you want to introduce yourself to everybody?
Yes, hello. Hello, everybody. I'm delighted to be here having this conversation with you all. And my name is Sadaf Lyons. My background is from healthcare. That's where I started off from. And so I'm not a traditional public health specialist. And I think you will find there are a lot of people who've come through different career tracks into public health. My background is from the UK. I've worked in the healthcare sector for a lot of my life, professional life. And then I moved into public health. And the reason why I moved into public health was because through setting up clinical institutes and centers of excellence, I noticed something that all of you would have noticed, that most of the health gains are actually made through public health programs, not through curative care models. And throughout my life, after I worked in the UK, my move to the Middle East really kind of generated some of the evidence and some of the more of the information around how important public health is. And, you know, preventative medicine and curative care models need to work side by side in order to deliver some of the health benefits. Now, I know in the introduction it was mentioned that I've lived in Malaysia. I loved living in Malaysia. I was in Penang, but I did a lot of work with the University of Malaya in Kuala Lumpur in designing health systems and looking at the intersection between public health and health systems and how we can focus on communicables and non-communicable diseases. In my current role with working as a senior consultant with the International Association for National Public Health Institutes, I have a lot of interaction with the African CDC in identifying what the lessons are learned from this pandemic, from COVID-19, the issues that they're having within the Africa region and the African states, and how we can put things like integrated disease surveillance systems to resolve some of those issues. And it's quite a broad area across public health. So that's my background, and that's kind of the angle that I'm coming from in terms of public health.
That is brilliant, Sadaf. And one of the things that occurs to me, and both yourself and Rebecca have mentioned this, is, public health is in the spotlight because of COVID-19, and, the work that colleagues at Johns Hopkins are doing in terms of, publishing all of that data and compiling it. It is phenomenal work. But when we think of public health, it is a lot broader than communicable disease management. And, when we looked at this program and devised it, certainly that's one part of it. But would you outline to people, because as you said, there are many different routes into public health, and there are a huge variety of career trajectories afterwards. But where do you see the kind of the communicable diseases versus other health issues in public health? Where do you see that going? Is it going to stick with kind of communicable diseases, or is it going to reverse rather quickly to looking at everything else as well?
I think that's a very important question, and that needs to be taken into consideration, especially why would you do a master's in public health? And why is this public health and health promotion? And I think, if you look at the history of how the profession of public health developed, it started off with communicable diseases because that was the most prevalent disease area, the transmission of diseases, the viruses and their impact. And then slowly, as our lives changed and developed, and there were more urban living settings, our lifestyle and behaviors changed as well, we've seen a shift. And the shift has been moved from chronic, communicable diseases to chronic diseases, which are non-communicable diseases. All of those have been multifactorial to where we are today, and which is more of a focus on the impact of non-communicable diseases on human health. And they are driven by your environment. They're driven by how we live our lives, the choices we make, the access that we have to different things that which impact our health. So I think, the COVID-19 has thrown a curveball, and there are lessons to be learned from that. We have seen the greater impact even on COVID-19 for those vulnerable people, and the vulnerable people have been not only the elderly, but those who have had pre-existing conditions. And that vulnerable group have had a large amount of people with non-communicable diseases. So I think one of the lessons learned is about how do we strengthen that prevention model, the promotion model, so that if we are faced with another pandemic, we don't have that devastating effects that we have faced with this current pandemic. So I think that's the intersection.
Yeah, and I think, where that brings you to then is the linkages between public health within a department of health or a ministry of health, and then all of the other intersections that it needs to have. And we had a webinar last night with a colleague who's very much whose area of expertise is in international development, and he would have spoken to the need for engineering, sanitation, roads, that it's all where public health can have huge influence is in actually infrastructure and how whole society is structured to promote health. And you touched there quite a bit on chronic diseases, and it leads me, the title of this master's is a master's in public health and health promotion. And I think, the tradition for the last 15 or 20 years has been, an MPH. It has been a Master's of Public Health. And why do you think it is important that when we were designing this program with Warwick, that we actually, we set out a very deliberate stall to say, this is public health and health promotion? And why is the health promotion piece as important?
Yeah, well, you'll find lots, as you said, you'll find lots of masters, which will be a master's in public health with a specialty in infectious diseases, for example, or in health service management, for example, you know, all the different kind of branches or specialisms that you get attached to public health. But then again, you know, referring to my last point that I made was actually, if you look at where the health gains are to be made, there's 20% of the health gains are made through curative care models and treatments and early intervention models. 80% of your health gains are made what happens outside of that. And so a lot of that hinges on health promotion models throughout the system, on a population base, on a community base, on a political, governmental level as well, and international level. So no matter what you do, whatever programs you design, you will always have a health promotion element attached to it. And that's because you can have a great impact through health promotion tools and actions. And so that's why it's really important to understand public health and the programs, the elements of those, but to be able to use the greatest impact tools through health promotion. And so that's, I think, the link that we've created through this program.
Yeah. And Sadaf, you know, the range of people that are attracted into public health and then the career trajectories they have afterwards. This is going to be an interprofessional program. It is going to have clinicians, it's going to have people involved in kind of administration and organization and strategy. So, you know, the people that will be with us on the program, they're as likely to have an MBA as an MD. Why do you think that interprofessional mix is a positive thing to have in a program, that it's not a homogenous group of, you know, 20 family doctors in a group?
Well, if you just look at my own qualifications, I've got a master's in zoology, I've got an MBA, and I've got a master's in public health. And this was all through, you know, my career development of where I thought I was interested in. So starting off with healthcare. Now, as I'm working in public health, I'll give you an example. I developed the National Antimicrobial Resistance Strategy. And in doing that, I had to consult with people from the Ministry of Agriculture, people from, you know, the husbandry fields, and from the Food and Drug Administration, and learn from them about how antimicrobial resistance is not just limited to pharmacists and hospital providers. There's a One Health element to it. So as you embark on your journey, those who will do the Masters in Public Health and after, you will see that one of the beauty of public health and working in this field is the intersection between all kinds of different professionals and all kinds of different disciplines, and how you have to work sometimes outside of your comfort zone with those professionals. One day you'll be talking to a behavioral scientist or something. The next day you'll be talking to somebody within municipality about urban design and healthy cities and what that looks like. And I think that's really an exciting opportunity for people to work outside of that area, to design these public health programs and implement them.
I couldn't agree more. And I think you know, having that embedded within your education experience then is really positive. The other piece that I'm massively attracted to is this is going to be a very international group that starts with us in October. That, yes, you know, we and we'll talk about the group structure and everything else in a few minutes, but effectively, you know, there are huge differences internationally in how things are managed, in the resources that people have and what they do with those resources, with the, you know, the influence of society, of politics, of policy on health, and being able to debate and discuss those with an international group, I think is going to be fascinating. I mean, we know from our work across the Gulf and across South Asia and Europe, you know, there are, you take any one clinical area and there will be, there's going to be a huge divergence in how it's prevented, how it's managed, scopes of care, you know, and being able to explore those with an international interprofessional group, I think is going to be a really, really enriching experience. But I suppose one of the things that you then come to is, what do you think are the career benefits of having a master's in public health and health promotion? You know, why would someone come on to spend, you know, a year or two of their life doing this, and where can they go afterwards? You know, what will it do for them?
Well, I think it's to do with your aspirations, the career pathways of, for example, working with healthcare, to me are quite limited, because you work in the provider sector. You're either working in primary care or you're working in acute hospitals. Public health opens lots of doors for people. You can work on a community level. You can work within the provider sector on prevention and promotional programs. You can work on a regional level, a national level, or even international for, you know, international NGOs, for example, international development work. So it kind of, and as you go through, as you will go through the master program, I think one of the really good things of the master program is the ability to be able to examine and look at all those different career pathways that people can then pursue. And you know, there are several organizations that are always looking for people with masters in public health. So I think there are lots of choices that people can make in terms of their careers moving forward after a master's degree.
Yeah, absolutely. And you know, as you've alluded to, it is going to be as rich and varied as the people that join the program in terms of what options they have and where they go. I'm getting conscious of time. We could chat like this for hours, but I'll go into the presentation now and give everyone an overview of the program. So please, as I do this, ask as many questions as you can in the chat. We really want to answer them. So, and actually, the first one as I share this is, sorry, I'll just get rid of that, is, you know, will we be graduated in MPH and HP, and what do we put on our CV? So the program formally accredited within Warwick is titled a Masters of Public Health and Health Promotion. So that is what will be on your certificate from the university. And I'll speak more about that in a couple of minutes. It is a Masters of Public Health. It's not a Masters of Science. So in terms of the abbreviation of an MPH, you can still use an MPH. Your degree title is a Masters of Public Health and Health Promotion, but unlike, you know, a Masters of Medical Education or a Masters of Science, it is a Masters of Public Health. So hope that clarifies that. One of the things you'll notice about the program is you're going to see IHEED alongside the University of Warwick. And I'll start by explaining who is IHEED. So IHEED is an Irish medical education organisation, part of the Cambridge Education Group in the UK now. And effectively, IHEED has worked with government ministries and health regulators across the Middle East in particular, South Asia and other countries, really to build capacity in health systems, particularly in family medicine and particularly in areas of chronic disease management. So what IHEED does is develop online or blended medical education programs. So everything from postgraduate qualifications like this master's in areas like public health, diabetes, medical education, pediatrics, etc., right up to residency, blended learning residency programs. So we have a family medicine residency program, for example, in Malaysia that's run with the Ministry of Health and with RUMC, which is used to be Penang Medical College for anyone from Malaysia here. And that's accredited with the Irish College of General Practitioners, and it's all about enhancing the capacity of the health system. Over the past 8 years, we've had over 400,000 course completions, and that's everything from short CME offerings through postgraduate right up to those residency programs. So what IHE does is enable the University of Warwick to bring something that they have on campus to a global audience, and to do that with an exceptionally high quality. Warwick themselves as a university need far less introduction. Warwick are ranked 8th in the United Kingdom, 62nd in the world. Last week, they were awarded the first place in the UK for teaching quality, and they are the runner-up University of the Year for 2021. They're a member of the Russell Group of universities, which in the United Kingdom is the top-ranked research-orientated universities. So, you know, it is an extremely prestigious organization. Their Masters of Public Health that they have on campus is ranked 3rd in UK. It's ranked 12th globally. So, you know, they have an incredible depth of expertise in public health. And it is the same leadership team overseeing this program as overseeing their campus-based program. One of the other questions I suspect we will get asked if we haven't already is, you know, well, where does this stand in relation to other Warwick programs? And the award that you get from the University of Warwick will be a Masters of Public Health and Health Promotion. It does not distinguish the fact that it is online. It does not distinguish the fact that it is part-time. It does not distinguish the fact that it is delivered in a kind of a distance model. So what you get is a degree certificate of either a postgraduate diploma or a master's from the University of Warwick, the exact same as all of their other qualifications. So there's no distinction between this program and any other Warwick program, which I think is really important for people to be comfortable with, that the standing and recognition of this program is equivalent to having done it on campus. The benefit, though, of this being an online blended program is the contributors are not just from Warwick campus. So Warwick faculty are involved in the oversight and delivery of the program, but it allows us to bring a far broader range of collaborators and facilitators and tutors into the program. And, you know, this is a selection of them. And by having a program that isn't structured in campus, you get to bring in, you know, leading international figures that have a really diverse, rich experience. And, you know, that in turn means the discussions and the debates that you have as part of this program are coming from a really broad perspective. So in terms then of actually what will you study on the program, the program is broken into 3 semesters, a postgraduate certificate, a postgraduate diploma, and a master's. And each of these yellow boxes here represents a module, and each module is 6 weeks long. And within each module, there is a topic per week. So the structure is really, really well defined. It's very straightforward to understand where you are within the program and how the program progresses. Sadaf, you have designed Module 1 with us. Do you want to speak to kind of what it does as an introductory module into the program?
Absolutely. So the first module, I think, is a really good introduction into public health. So what our aim is to introduce the essential components of public population and personal health. What does this actually mean? The history of public health. But each of these elements that you can see on the screen will be then there will be an in-depth element in the subsequent module. So it's not as though you're only going to look at these components here and that's it, they're done. So they're all linked into what the students will be learning in the other modules as well. So I think it's a really good introduction. It's a good way for you as students to start your journey into really understanding the basic concepts linked to public health.
Yeah, absolutely. And then the second module is one that some people will look at and they will see, you know, epidemiology, fine, and they might get nervous about statistics. And I think the understanding data is a key part of evidence-based medicine, but it's also it's a key part of public health. It is being able to analyze and interpret data so that you can draw conclusions and findings from it is exceptionally important. So I think what we would say is the focus of the second module is very much the interpretation of statistics. You won't be doing kind of research with a capital R and be deep in the bowels of SPSS or other software creating statistics. You will be effectively learning how to critique and to analyze and interpret data that you're presented with so that you can make sense of it and make decisions based on it. So again, that having an overall introduction and then having that evidence base behind you is a really important start to public health. And then when we go to the third module, really then what we're looking at is kind of social determinants of health. And, you know, where does the interplay between society, between politics and infrastructure, how does all of that impact on health? Sadaf, do you want to add anything on the third module?
I just wanted to say that, you know, it's really important that when we're looking at public health, and this is what this module actually touches upon, is not only the influence of the society and the environment that people live in, the population live in, but it's also about the decisions that need to be made on a political level, which drive changes to policy and decisions around national programs that are then implemented. So I think that's quite an important point within this module.
Absolutely. And, you know, we have seen, obviously, you know, again, COVID has shone a light on this in the communicable disease arena, where we've seen disastrous political decisions and brilliant political decisions. But even when it gets down to things like sugar taxes, things like diabetes prevention strategies, that, you know, across different countries, you will see vastly different strategies employed, and understanding the impact that decision making has on health is absolutely vital. So these three modules together, so 6 weeks each, make up the first approximately 6 months of the program, and they bring you to kind of the postgraduate certificate level. And we kind of label this, you know, the basic sciences of public health. And then when we get into the second semester, so again, another 6 months made up of 3 6-week modules, we're really into, I suppose, what's the art of public health and how do you put this into practice? Sadaf, do you want to talk about health promotion again? It's something yeah.
Sure, absolutely. So this module then brings it down to what kind of tools do you need in order to have the highest impact on society, on populations, on organizations. It will bring to the forefront, you know, the kind of approaches that could be used by public health professionals, but also teaches how you interact and the interface between different organizations, and whether that's communities, in terms of changing people's behaviors and lifestyle, whether that's within health systems and how you introduce more early intervention programs and prevention programs. It's communication on a population level. So there are various aspects that students will be looking at and how to communicate. You see, the thing is, when you're a scientist, you look at things from a very scientific perspective. So that's where we're looking at the previous one around epidemiology.
Yeah.
And you can get into the science, but the beauty of this, of health promotion, is then how do you take that scientific intelligence and package it and produce it in a way that is not only understandable to all these different diverse groups that you have to work with professionally, but then translates into action.
Yeah, it needs the resonation.
I think through this module, those are the kind of things that students will be learning how to do.
No, absolutely. It needs to resonate. It needs to drive behavior ultimately. And it is only in the last number of years that we've come up with the term of science communicators, of people that are in the public eye, particularly on social media, that are driving that agenda and are really communicating, well, this is the data, and actually this is what it means for you, and this is what it means for your family and your city. And that is incredibly important. And that leads into some of the issues covered in module 5 on international health and sustainable development. And there are areas where if you are female, you will have worse health outcomes than if you are male. If you are of a particular ethnicity, similarly, the impact of the impact of climate change on health, the major events, things like refugee health, all of those, they are again really important at a local and national level and international level to explore. And again, you can see how the program is moving on from the kind of the basic sciences of understanding what is public health, what is health promotion, what is the evidence base that I'm looking at, and how to interpret it, and then into how do I apply this either in my locality or at a national level or on the international stage. And I think the final module of this semester then, when I look at this, Sadaf, it is, and we've spoken quite a bit today on the need for interprofessional relationships. And most people that are aspiring to a career in public health will find themselves in a leadership position. And once you're in that position, you need to understand the financial implications of either the policies you're proposing or what you're asked to implement. You need to understand how to sit around a boardroom table, why people will resist change and how change occurs. And I think, we've spoken previously on, the development of policy and why this is so important in public health. So I think, what we're seeing across these 2 semesters is very much the development of expertise in the student, from a understanding of an overall view of public health, the evidence base, the things that will influence health, and then really getting into, well, as a practitioner, and this can be in many different areas of public health, but actually, how are you going to have impact, and will you have the tools to draw from? And I think some of this needs to be deeply practical, that people need to be able to write a position paper, people need to be able to structure reports, they need to understand economic models. And in that regard, we hope it will give a very practical toolkit, as well as a very solid academic base that people are operating off. Is that a fair summation, Sadaf?
I think that's absolutely right. And what we have done, and you will see, is we have put material in there that is not just related to the Western world or high-income countries. There's a diversity in terms of the materials and the examples and the publications that you will see that takes fully into account people from lower middle income countries, the challenges that they face. So this is not from a mature model of what public health looks like, but it also takes into account the different contexts and international settings in which our students will be working in or living.
I think that's a hugely important point. You know, we have gone to great length to make sure this is not simply a UK qualification that's being transplanted and given to people across, you know, the Middle East, Africa, South Asia, etc. That it takes that local context into account, and it, you know, I think having an international audience will then enrich that experience, but also give different perspectives. So you'll have the kind of the local application, but also knowledge of, well, what does happen in other health systems. And as you say, there will be a huge mix of resource settings within that. So I'll move on. The third semester then is where we're at master's level now, and we're doing research. And this is where, as a student, you pick a topic that is of interest to you, and you go through what is a reasonably standard research journey of, you know, you identify your research idea, you review the literature, you come up with a research question that you want to ask and a methodology that will help you answer it. You get a proposal approved by the university and through ethics if necessary. Then, you know, you're into data collection, and ultimately then you write your paper. And where I think Warwick are particularly enlightened is what they ask you to produce at the end of your master's. Behind me on the shelf here are two dissertations that are unread by most people. My wife lies to me that she's read it. My parents probably have, but, you know, aside from my supervisor, not many people. What Warwick asks you to do is not produce a 15,000 word dissertation, but actually produce a 4,000 word journal article that you will hopefully then go and get published after your master's, and give us a conference poster presentation, which again gives you something of utility that you can use very practically after the program. So, you know, if you go through this program and you develop an expertise in an area and you study it in detail, we want to think that that will add to the body of knowledge in public health in your region. So we want to see people getting their publications out there into journals and adding to the evidence base. So what we've covered off so far is very much, you know, the structure of the program. What I want to look at now is actually, what does this mean for you as a participant? And the first thing to say is, it is structured as a small group program. So we'll have people in groups of between 20 and 25. And that immediately then limits the program size. We'll have a group in kind of the Europe-Africa time zone, we'll have a group in the Middle East time zone, and we'll have an Asia-Pacific group. And, you know, those groups will be about 20 to 25 people each, which means you will get to know your group really well. You'll get to know your tutors really well. And there's lots of kind of safe space for discussion and debate. We have been running programs with Warwick for years, and we've learned very well what really suits people who ultimately are full-time professionals and part-time learners. And the taught modules in particular, that 6-week module, that rhythm really works well. It is designed from the outset to be an online program. It's not a program that was a campus-based program that is now, because of COVID, delivered online. And as such, you know, it's been designed that you can keep this program going alongside your clinical or your professional commitments, and, you know, maintain your sanity with your family life, etc. So that, you know, the personal commitment for the program is achievable on a part-time basis. And that is underpinned by massively strong support. So aside from the faculty, who are amazing, the program management team, you will see them every week. You will see somebody from the program management team every single week. There's always somebody to ask a question of. There's always somebody who's thinking ahead and offering guidance to you on how you progress through the program. So in terms of actually then how it works, so when we start in October, we'll start with a really comprehensive online orientation, and that will get you used to the structure of the program, the assessments, the regulations, all of that end of it, but as well, how to use the online learning environment, who your tutors are, where to go for support. So really, we make sure that before you start module 1, week 1, that you're really, really comfortable with everything to do with the program. Each week then, and we've seen on these slides that, each week has a particular topic, and within that, each week then will follow a pattern. So if we're looking at environmental health, for example, in week 3 of module 1, we will start that with a discussion activity on the online platform, and that will pose a question or a scenario to you to debate with your colleagues in your group of 20. That then gets you thinking about the material for that week related to that topic. And one of the questions that we often get asked is, well, what textbooks do I need to buy, or what do I need to do for material on the program? And the answer is nothing. All of the heart of this program is the most amazing online platform with bespoke content developed specifically for this course. It's all, it's mobile ready. It's really interactive. Anything that you can see that's kind of looks like it might be clickable generally is. We're exceptionally conscious that as an international program, lots of people on the program, English will not be their first language. So it's very visual. It's very, it's not PDFs. It's not kind of people talking over PowerPoint. It's all really, really high-end e-learning content. It's peppered with video throughout. It is great the way, if I'm doing this on my mobile this evening, I can pick it up on my laptop later and it will remember exactly where I am. So you go through the discussion, you walk yourself through the online content related to that week's topic in your own time and pace. And then towards the end of the week, so on a Thursday evening, for example, in Africa and in Asia, or on a Friday morning in the Middle East, you come together with your tutors for your weekly tutorial. And this is 1 hour a week. There's multiple sessions running, and we have times that tend to suit most people. And really, this is what brings the content to life. It's not a lecture. It's very much a group discussion on whatever the week's topic might be. So if you are looking at, if you're looking at health promotion and, individual and societal changes, we'll start with a conversation topic on the platform around that area. So it might be, what can we do to promote healthy eating? What can we do to promote exercise? And whatever the topic might be, you debate that on the platform, you walk through the materials, and then when you come together with your tutor at the end of the week, you're having a discussion on actually how you can implement this. And this is the piece where the international interprofessional mix on the program really shines, that you'll get people that will have different perspectives and different experiences than you. The assessment on this program is A, straightforward, and B, linked to the content you will have covered. So in general, you will be asked to write a couple of reports on the topic areas covered within the content. And that will be, read the evidence around health promotion, around diabetes prevention, whatever it might be. And then how would you apply that in your local setting? That is generally the theme that goes through all of the assessments. There will be one examination, and that will be on the interpretation of data in module 2. But I think, a lot of people can be apprehensive about assessment when they think of a program. We will have a very high caliber of learner come onto this program. The faculty and the online content, the experience you will have is exceptional, and the assessment will be fair. So you'll see some of the statistics in a couple of minutes about pass rates and stuff, but we expect people to get through this program, and we expect them to get through it well. in terms of how people do, we have, and this is data from one of our programs with Warwick, where we've had 500 students from 36 countries over the last 3 years. The design of the program, and this again goes back to these programs are designed to be online from the start. They're not reactionary to COVID. 88% student engagement tells me that the design is good. Most people can get to their programs most of the time. They have a hugely positive experience, and these statistics they don't tend to change year on year. When it comes to program support to organization, the tutors in that program management team, people have a really positive experience with them, and then 92% pass rate. So the vast majority of people that join the programs succeed first time and do really well. So the assessment is not something to fear. And I mean, what's very hard to get across in this type of environment is actually the amount of fun you will have, the relationships that you will develop with colleagues around the world on this program that will last. And in terms, we've spoken about some of the career trajectories from this, but in terms of kind of what the actual outcomes are. So obviously you're getting an award from a top 10 UK university, and Warwick is recognized globally and particularly within the public health space. So your academic award is the exact same as any other award from the University of Warwick. You meet the academic requirement if you're looking towards a public health consultant training. The syllabus is mapped to the Faculty of Public Health. So again, if you're looking to go on and do those professional exams, you're mapped to that. What we haven't touched on is the transferable skills that this program gives you. Obviously, research within the master's module, but also everything from sorry, I'm skipping back too quickly. Everything from data analysis in module 2 to kind of financial management in module 6. Like, there's an awful lot of critical appraisal, of report writing, there's a broad set of really transferable skills that you will bring from this program that'll be important to many other aspects of your career. So the other area that we always get asked, and then is, right, what do I need to do to join? And so what we're looking at is an honours bachelor degree. That is the kind of the base standard to come in. It will be an interprofessional program, so it doesn't really matter what discipline that is in. You're not going to be on campus in the UK, therefore you don't need a visa, therefore you do not need a formal English language assessment to come onto the program. However, it is conducted through English, so you need to be comfortable that your standard of English is good enough to understand everything that's on the program and to write reports, etc., through English. So what we will ask you for in the application process is a copy of your degree, a personal statement as to, your motivation to join the program, and that really, that helps us assess the standard of English that you have, and then an employer or an academic reference that effectively says you're a professional in good standing, and photo identification. So, it's a really, really simple application process. What I go back to, though, is that the program is grouped into those groups of 20 to 25. And that means there are limited spaces on the program. So the way we accept applications is, people that have that meet the criteria, that pay their program deposit first, they get the spots on the program, and we do expect these to be oversubscribed. So in terms of pricing, the university is amazing to work with when it comes to making the programs accessible. If you were to do this on campus in the UK, the cost would be in the region of £27,000. They have agreed a significantly reduced cost for the online program that we can deliver internationally, but a further reduction again for particular countries that that meet low middle income criteria. So the fee for most people on this call will be, for the master's program, £9,000, and for the postgraduate diploma, £5,000, which is, for a qualification from the University of Warwick, it is exceptionally good value. Recognise it is still a large amount of money, but it is, for a top 10 UK university, it is exceptional. There are further reductions available until the end of this month, where if you register early and or pay early, you can see there are very reasonable reductions again on top of that. So, and to clarify, the total price, if you do the full masters, is 9,000. It includes this fee here, which is the postgraduate diploma, which is 5,000 if you do that. If you register early, then obviously you get these reductions as well, which is great. So, you know, the comment has come in, you know, candidates from developing countries. I think Warwick have gone out of their way to recognise that as an international programme, you know, they cannot charge standard UK pricing, and that even versus international pricing, that we need to have recognition that, you know, people in developing countries or developing economies, the pricing needs to reflect their situation, and we sincerely hope that this does that. So I'm going to stop talking in a minute, and just to recap though, so what we've got is a 22-month master's program that has 3 exit points: a postgraduate certificate, a postgraduate diploma, and a master's qualification. The intake is on the 24th of October, and it is filling. It's filling fast, which is brilliant, but you know, those spaces will fill up. So if you are interested, do apply. We work alongside the academic qualification. We work very hard to make sure that, you know, you get continuing professional development recognition for the time that you spend on the program as well, so that it has local recognition and endorsement as well. The program, and we could probably go into this if we have more time, but the fact that the program is part-time, that it's designed to fit around your needs, that, you know, every tutorial is recorded, everything is available for you to watch back afterwards or to read ahead on, you know, it is designed that people that are full-time professionals and part-time learners can succeed on it. What is incredibly hard to get across on a webinar like this, which is very one-directional, is how engaged you will be with your group, how engaged you will be in conversation with your tutors. There's a huge support network, and, you know, as much as an academic program can be fun, the experience you have will be really, really enjoyable, and, you know, you'll gain a new network, you'll gain a whole host of new skills, and, you know, get new career opportunities ultimately at the end of it. So I will stop share here and see, Rebecca, is what has come up on chat that I haven't dealt with? Let me see. So if I go back,
my inbox is going nuts. I'm just taking out Outlook there, which is great. It's a good complaint. Loads of interest on my inbox. The guys have answered an awful lot of the questions as the chat has progressed. Asked, and one of them I think is worth reiterating again is the title, if you don't mind, Dermot, because I think it's really important. There seems to be a debate between MPH, MSc, Masters of. And I think it's important because that, you know, there's a lot of weight in that.
No, absolutely. So everyone has kind of full comfort. The formal title of the program approved by the university is and I'll put it up on screen again, it is a Masters of Public Health and Health Promotion. In terms of the academic category that sits into, then it is a Masters of Public Health. It's not a Masters of Science. It's not a Master of Arts. It's not a Master of Education. It is a Public Health Masters. So it is an NPH in that regard. The title of the particular program, though, is a Masters of Public Health and Health Promotion, because that's where we have chosen to put the emphasis, is on health promotion after the basic sciences. So in terms, I suspect what's behind that question is, does this have the same standing internationally as an MPH? And I think unequivocally, yes. To Sadaf's earlier point, and jump in here and elaborate if you'd like, Sadaf, but most master's programs will have a certain flavor to them, and that will be reflective of the priorities that either the country or the institution that is awarding the program has. With Warwick, we have looked very hard at the work we do and at the work Warwick does internationally, and health promotion is where we think the science is pointing us. So that's the rationale for the naming convention. Sadaf, is there anything you want to add to that?
No, I think you've explained that very well. And I think, if we're looking at developing sustainable public health systems moving forward, health promotion, I think I said that before, health promotion runs throughout every single element of public health professional programs. So it's just ingrained and so important. And so I think, as you said, this is where we have decided to put the focus on through this master's program.
Yeah, absolutely. There's a question in there about payment plans. Yes, absolutely. So when you pay your fees, you can choose, and I'll bring the fees slide back up for a second. So when you, share screen. When you pay your fee, so if your fee ends up being, say, 8,250, you'll pay a deposit to come onto the program, but after that, you can then pay your fees. Obviously, you can pay them up front. The university welcomes that. Most people will pay by semester. There is also a monthly payment option available, and that will split the remaining payments either over 10 months or 14 months, depending on if you're doing the postgraduate or diploma or the master. So you can break that amount down into what are hopefully manageable amounts on a monthly basis if you need it.
Sorry to interrupt you. There has been a lot of questions around scholarship. Just to be very clear that this program is heavily discounted for the LMIC countries. It is normally 12,000 sterling, the master's, and 8,000 for the postgraduate diploma. But we have reduced the price significantly in recognition of price affordability. We do realize that it's still very, very significant in terms of local earnings, but it is extremely affordable in comparison. For example, the face-to-face program in the University of Warwick would be, it ranges from 24,000 sterling to 32,000 sterling, depending on which program you're studying. But for the MPH, it is very significant. So it is a fraction of the price of studying face-to-face in the university. So just to be very clear, and there are some funding opportunities, and some of our existing students across multiple programs have got funding from their employer, from the Red Cross, Red Crescent, a lot of development organisations, and from their local Ministry of Health, or for example, in the UK, the NHS or Ireland HSC. So there are funding opportunities for some clinicians, but unfortunately you would have to seek that support yourself.
I think the other important point I think to make in relation to the fee and what's included in the fee, there are no kind of annual registration fees, there are no assessment fees, there are no textbooks you will buy. That fee is the only fee you will need to pay for the program. And I think genuinely, for the caliber of faculty, the quality of experience, and the level of support, while it is always a significant investment, I think it's a very worthwhile investment. I think it's I think the value you get from it is extremely high. So yeah.
Sorry for cutting across you again, Dermot. And just to let you know, our education advisors will be calling you in person by phone, just to go through everything you've heard today, and they can walk you through the payment plans in meticulous detail to let you understand exactly what you'd have to pay on a monthly or semester basis.
Yeah, absolutely. I'm just scanning through the chat to see if there's anything else that I've missed. I don't I'm not seeing anything so far. It is, as we said, it is an interprofessional program. So the particular bachelor degree that you have does not matter. It is open to all professions and people from all backgrounds that are interested in public health. And yeah, so that's probably the only one I'm seeing this.
Minna from Malaysia was asking, so there are no examinations throughout the program?
There is one small examination in module 2 where we will present you with statistical data for you to analyze. There will be a mock exam in the lead up to that, and there is compensation between exam elements, so it's not something to get concerned about. But no, for all the other taught modules, it is reports and essays is what you will produce. And obviously for the master's element itself, the research piece, you'll produce a journal article. So very, very practical assessments. Yeah, there's not lots of exams at all.
I think that's it.
Okay, fantastic.
Thank you so much to everybody. Thank you particularly to Sadaf and Diarmuid for hosting and being just wonderful today. And I hope we've given you and everybody who attended today sufficient information to make your decision. Having said that, if you still have queries, our education advisors will be calling you by phone to see if you have any other queries or if there's anything else we can do to assist. And it is 100% online. Mohammed has just asked that question, so there's no necessity to attend the university in person.
Yeah, absolutely.
Thank you so much,
everyone. Thank you, Sadaf.
Goodbye.